It's Lindsay Smith-Rogers, producer and co-host of Public Health on Call. Thank you for joining us for this season of the podcast. We'll be taking a break the week of May 25th, returning for season 14 on Monday, June 1st. As always, please keep sending your ideas and questions to publichealthquestion@jhu.edu, and thanks for listening.
Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers, and it is graduation week at the Johns Hopkins Bloomberg School of Public Health. Today, we're featuring an interview with one of our graduates in the Doctor of Public Health, or DrPH, program. Della Wright is the Director of Evaluation at the Deep South Center for Environmental Justice, and she speaks to Dr. Josh Sharfstein about her path to public health, her work at the center, her doctoral dissertation, and what comes next. Let's listen.
Della Wright, thank you so much for joining me today on Public Health on Call. Congratulations on your graduation.
Thank you so much, and thanks for having me.
So take me back to the decision to come to study at the Johns Hopkins Bloomberg School of Public Health. What were you doing then, and what had led up to that point in your career?
Well, I guess my journey towards the field of public health and what attracted me to the field in general is that it is so broad, and I feel like anyone could find a path for themselves in public health. And mine has changed many times over the last 15 or so years. So I kind of came to public health through an AmeriCorps posting immediately after my undergrad degree. And that brought me to New Orleans, which has been my home ever since. And I was focusing on HIV prevention, and I was working in an organization that focused on reproductive justice and sexual health. And everyone there I thought was so cool and interesting, and realized that they all sort of described themselves as public health people. And I was like, okay, well then maybe that's what I am too. So I went for my master's at Tulane School of Public Health, and, continued working in the field for several years. I transitioned into working in the environmental justice field, and I really just felt like I needed a lot more training. I love working in community settings, but I wanted to kind of expand my network. And so as I looked around and saw people whose careers I really admired and who I might, want to be like one day, I found that a lot of them had a DrPH.
Talk to me about the DrPH degree and how you went about pursuing it at the school.
I guess what was explained to me by people who had a DrPH was that it's really a more practice-focused degree. So whereas I saw at that time a PhD in public health looking like a career in academia, I don't think that's necessarily the case, but that is the sense that I had at the time. I saw that a DrPH allows you to really stay in community, in practice, and really working directly with people. And so I thought that that sounded like what I wanted to do. Hopkins has a fantastic program that allows you to continue to work at the job that you're in, continue working in your career, in your own home. And so I wanted to really meet new people, broaden my network, but I wanted to stay rooted in the Gulf Coast. So ultimately, the Hopkins program was a great fit for me.
So you pursued this program while you were still working in your job, doing classes, for example, in the evenings, and coming from time to time to do classes on site?
Yes, exactly. So my classes would be in the evenings or asynchronous sometimes. So I could take them when I had a break from my job. And then I began in 2019. And so I was able to come to a few winter and summer institutes at Hopkins where I could be at sort of an intensive in-person class. Then when COVID started, everything shifted back to fully virtual. So I did do most of my classwork online.
So tell me about your job and how your employers felt about you doing this whole doctoral degree in public health while you were still working for them.
Sure. So I work for the Deep South Center for Environmental Justice, which is a community based organization and the first environmental justice center in the United States. And so I work there as the director of evaluation, and I evaluate our programs, understand and share our impact. And I would say my organization was incredibly supportive of my pursuing this degree and of my spending the time. They saw a lot of value in what I was learning and that I could, bring a lot of development to the work that I was doing in communities here.
It sounds like through your studies at Johns Hopkins, you could actually do your job better if you're responsible for evaluation of different projects at your organization.
That's definitely true. I learned so much. I originally came to the job mostly self taught in the area of evaluation and community based research. I learned a lot on the job, but that wasn't my focus in my master's program. And so I definitely learned a lot more about methods and different approaches that have helped me to do a better job of understanding and communicating our impact.
So, the Deep South Center for Environmental Justice, tell me about the work of that organization.
Sure. So the Deep South Center has been around since the early 90s. We're rooted in the Gulf Coast and located in New Orleans primarily. And we support communities throughout the country and internationally who are experiencing environmental injustice. So the unfair and disproportionate burden of environmental hazards like pollution, vulnerability to disasters based on race generally, and income, and other kinds of factors that influence those risks. So we do that through training and education, through community based research and partnership with organizations to build their ability to fight for justice in their own communities and own homes.
So, we're talking about, for example, communities that feel like the pollution is coming their way disproportionately, and they're wondering what they can do to fight back.
Absolutely.
And how does the Deep South Center work with those communities?
Well, we approach that by letting communities direct what they want out of partnership. So, a lot of times, what we can offer is partnership where we help people understand the risks that they are experiencing. So, education and training about the hazards that might be around them. We partner with academic institutions and researchers to work with communities to gather data to illustrate the problems that they're experiencing, and we help people to develop the partnerships and allies they need to advocate for policy change that would ultimately address the circumstances they find themselves in.
Now, you oversee evaluation for the center. What
Mhm.
does it look like for one of those partnerships to be successful?
So, we're really committed to participatory evaluation, which means that the people who are doing the work and are the recipients of the work are the ones who are defining what success will look like for them. So that's where we always start is what would success of this project look like for you? And then we kind of work backwards to figure out how we will measure that. So often this is documentation of stories. It's a lot of qualitative work, a lot of policy analysis, and a lot of times we're looking at incremental change. The kind of work that people are focusing on could take 10, 20, 30 years to see the ultimate outcomes. And so we really need to look at the things that happen along the way to see if we're going the right direction.
Can you make that tangible, maybe with an example?
Sure. So if I live in a community that's polluted by petrochemical facilities, for example, what I want ultimately is clean air. What I want is I don't want my community to experience more cancer, more reproductive issues, more health issues in general. It could take years to see a real change in those kinds of rates of illness, right? But we can look at the reduction in air pollution. We can do that by measuring with community air monitors, the rates of pollution in the area. We can also look at policy change that would support those ultimate goals like health improvements. So we can look at permits that have been awarded or rescinded for those kinds of facilities. And that is also something that's not always in our control and is very dependent on political context. So we can also look at what are we doing to fight that political context, even if it's not going our way. We can look at how many people are coming out to advocate together. We can look at the impact of letter writing campaigns, of making public comments, and of public participation in general.
That's very, very helpful. Now, I may have this wrong, but I want to confirm that a DrPH degree is not just taking classes and coming to institutes. You've got to do a pretty serious dissertation in order to walk across the stage at graduation.
That's right. You definitely do.
Tell me about that project for you.
Sure. So my dissertation research, which did take me several years, centers the communiversity model, which is the model we use at the Deep South Center for communities to partner with academics to achieve environmental justice goals.
Say that word again, communiversity?
The communiversity model, community and university together.
So what's the goal of having community and university work together on issues that relate to the environment?
Well, communities and universities or academics or researchers in general have so much to offer one another, but there is such a history of tension between those communities where people often feel exploited by academic institutions or researchers who might come study their problem and they don't ever see any results. So the communiversity model was designed by Dr. Beverly Wright, who's our founder, to address those kind of tensions that have existed. So the model really lays out what an equitable partnership looks like between communities and academics and how that can be done in a responsible way that also really catalyzes policy change and policy action.
And tell me about your research on this model.
So I did an evaluation of the HBCU-CBO Gulf Coast Equity Consortium, which was one of the big title, which was one of the most recent applications of the model. It was a project that was throughout the Gulf Coast from Texas to Florida that paired faculty members from HBCUs or historically Black colleges and universities with members of community-based organizations to work towards an environmental justice goal together. So I looked at case studies of those 5 communities to understand how the model works, so sort of its core components, and then also what it can produce, what it has the potential to produce. And then I created an implementation guide so that communities can move forward with implementing the model on their own if they choose to.
It's a really great read. I loved reading your dissertation, and I appreciated the guide at the end, which I think is important not just for communities, but for their academic partners. So what is next for you? You're now going to have a doctor in front of your name. You're going to be able to use the various research and skills and trainings that you've had as a student to support the work of the center. How do you look back on your time at the school as you think about going forward?
Well, I'm thrilled and honored to have had the opportunity. I have learned so much in this program and have come out just a much more capable researcher and public health practitioner. And I feel much more prepared for wherever my path takes me in the future. But that being said, what's next for me is really more of the same. I'm in the same job that I was when I started, which might be uncommon for people who go through this program. It did take me 6.5 years. And I love the work that I do at the Deep South Center. I love doing work in communities to evaluate their work, help them understand if they're using their time and their limited resources wisely to share their stories. So that is really my passion. I feel better equipped to do it in a more systematic way. I have a better network to share those stories with. And I just hope to continue making sure that everyone really sees that participatory methods are the science that they are, and that communities have the power and the capability to do rigorous research. So I just want to keep advancing that work.
Della Wright, congratulations on graduating. It's really an incredible milestone for you, and it is great to know that everything you've learned is going to be put to use at the Deep South Center for Environmental Justice.
Thank you so much for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.